The Herma Heart Center is a center of excellence. It is one of the best places for kids with challenging heart conditions to be cared for.
What we have here at Children's is a real unique blend of excellence in clinical practice that is also driven by excellence in research and a desire to never settle for the status quo and always look for opportunities to improve.
If we didn't use new techniques, new procedures, new diagnostic methods, we would be living in yesterday.
I think innovation has been a part of our spirit and our culture since the beginning of our program.
We do have a real culture here that expects not only excellence in our care, but a challenging of each other to get better, to be better.
If you're at a center that does have a group of physicians and scientists working together to look at these problems, that's a center you want to be at, because you know that all hands are on deck to get the absolute best care for each individual child. We're constantly pushing the envelope on the kinds of treatments we can provide for kids.
In the 24 years that I have been here, it's really been just a wonderful rocket ship ride of progressive innovation and success.
One of the very, very first innovative things that we accomplished was looking at babies with very complex heart disease where half of their heart doesn't form.
I still remember physicians asking what our survival rate was for the Norwood procedure for hypoplastic left heart syndrome. And our survival rate was about 75%, which was pretty equivalent to what everyone else in the country was getting. They said, that's not good enough. We're not satisfied with that. We're missing something.
They were able to find a way that was 180 degrees different than what was being done and could prove that it worked and could really understand it and publish it. And from that, we became internationally known in that care.
We saw that survival rate go from 75% to 95% in the span of just over 1 or 2 years.
Our surgical results are now the standard by which all other centers measure themselves.
Today, that's the operation of choice.
But we're not just satisfied with survival. Obviously that's critical, but we also want children not only to live but have a high quality of life. Survival's one piece. Quality of life is such an important secondary piece.
One of the innovations I'm most proud of is that we were the first program in the country to establish routine developmental follow-up for children with heart disease.
What we really now focus our energies on are quality of life, on neurodevelopmental accomplishments, and really getting kids back into just being kids.
We hope that what happens here in the hospital is only a small portion of this child's life and what really impacts that child and family long term.
We want them to have a great quality of life. We want them to go to school. We want them to grow up and have a job and to be able to be followed in a center that can do all of that for them.
Once you've understood how to take care of the sickest kids, all the benefits of how to identify and manage the sickest kids easily tumble down to the kids who have less severe heart disease.
We've been able to take care that required the operating room and move it into the cath lab where it was much less invasive. Care from the cath lab has moved to the bedside, and actually care that was inpatient now has been able to be delivered on an outpatient basis. So by pushing the envelope, we actually have helped a much greater population of kids.
It's thrilling for us to interact with these children after they get better and see what kinds of lives they go on to lead.
You go to our annual picnic and you see these kids running around the zoo. Boy, you could stay up 28 hours a day just to get that outcome.
I hope we can minimize the problems and maximize the good outcomes that these children have the potential for.
But the question remains, what keeps us up at night? And what is it today that we could do better?
All I've seen is us get better every day in every aspect of how we care for children with congenital heart disease.
We're at a time now where we can do more than ever before in terms of the complexity of the reconstructions that we do.
Until we eradicate the world of congenital and acquired heart disease in children, we're not finished.